Hi, my name is Savannah Brown, and I have two main goals of this video. The first one is to give you the purpose behind the importance of IV medication administration, and secondly is to give you a few visual aids for the definitions that are provided in your handout. So, let's get started. One of the purposes behind IV medication administration is if you have a medication that you have to give 5 or 6 times a day, and it can either be given through IM or IV route, you and your patient are going to choose the IV route every time. A patient would rather be stuck once with an IV and the medication be given through the IV versus having to be stuck 5 or 6 times and the medication be given IM. So that's just one reason. Another one is if a patient is NPO, can't have anything by mouth, or can't swallow for whatever reason, it's important to have IV access. That way the patient can receive fluids, vitamins, and electrolytes through that IV site. Another reason is you have immediate access to the bloodstream. So if you have a patient that is coding, you can give a medication through the IV and it will create an immediate response and hopefully a positive response. When you have someone coding, you don't have the capability to say, hey, take this medication by mouth, or let me give you this shot and let's just wait and see what happens. You literally have seconds to save a life. So it's important to have IV access for those emergency situations and for a medication to be able to react quickly. Another reason is there's no barriers when you're administering a medication through the IV route. When you take a medication by mouth or through sub-Q or IM routes, the medication is going to be absorbed at least a little bit through the food that the patient has taken, eaten, or through the surrounding tissues. When you have given medication through the IV route, there's no way for that medication to be absorbed in any form. It goes straight to the bloodstream. Another reason why IV access is so important is you can administer large amounts of fluids for a continuous period of time to the patient. If the patient is NPO, the patient can have these fluids running at all times and a large amount of fluids. The last reason is to administer blood and blood products. You have to have an IV site. So if the patient is hemorrhaging or in surgery and losing blood, and the patient needs to receive blood or blood products, it's important to have an IV site because that is the only way blood products can be given. So that is a few purposes behind IV medication administration.